Welcome to Newsworthy Stories with Jacqueline Jimenez. I have a great story to share with you today of how the Community Foundation of Broward is behind cutting-edge cancer research right here in South Florida. They gave researchers an opportunity to share their results after 3 years of study to philanthropists who might support them. The Community Foundation of Broward providing a platform for doctors behind cutting-edge cancer research right here in South Florida. The researchers presenting their remarkable findings to philanthropists who might be interested in supporting their next steps.
These researchers are just amazing. They're so committed to the work and they're so committed to caring for their patients and finding the right cure. I think one of the takeaways from today is the discussion about how the care becomes so individualized, that you need to study the person and their cancer and then what kind of drugs best treat that particular cancer and that particular person. And so some of the research we learned about today is really starting to examine that. And I'm very excited about the future and how our organization and the funders here at Community Foundation are playing a little tiny role in our fight to end cancer.
I'm thrilled to see this kind of initiative going on here because it's sort of been something you don't want to talk about, that if you really have a serious health issue, you have to go out of state. You have to go to Harvard, you have to go to MD Anderson, you have to go to Sloan Kettering, and that's changing. And it's very encouraging to know that we're doing real research here, and I think that the future is looking a lot brighter for Floridians, not to have to leave the state to get state-of-the-art treatment, but that we're going to be doing that here now. That's not something I'd planned to say, but I recently myself had a breast cancer diagnosis, and I'm very lucky. It was caught on a regular mammogram screening, stage 1, grade 1, very small, very early. It's already been dealt with. I'm already finished with it, so I'm lucky, and I just caught it on a regular screening.
Today we have the opportunity to reflect on how local philanthropy is fueling real progress in our county in the fight against cancer. You're going to hear directly from the doctors and researchers leading groundbreaking studies that aim to make cancer care more equitable, personalized, and accessible for every resident in our community. Since 2016, our foundation has invested more than $3.1 million in 13 organizations in 34 different projects. These investments, made possible by the generosity of our fund holders, are changing the landscape of cancer care in Broward and helping ensure that in Broward, our people can find hope.
Thank you for inviting me to be part of this wonderful event. I think I've done it now once before, maybe twice, and I really enjoyed the investment that we're making in our community and from the leadership of the Community Foundation and the Board of Directors. From areas like cancer, Alzheimer's, which is becoming, and it is an epidemic as well, to infectious disease research, halting the progress of the studies of this doesn't help our society. Today's panel represents 3 distinct cancer research projects, all made possible again through that philanthropy from the Community Foundation and their grants. The work you hear about today is helping not only in individual patients, but also building the systems upon which all the models will be built, and hopefully it will change outcomes across the country. These projects are proof that when we invest locally, we can innovate globally. And we can do it while ensuring that diversity is at the forefront and the underserved populations that we have here, and there are many in Broward County, are not left behind.
One researcher who was not able to attend this discussion shared this.
Over 60,000 women are diagnosed annually with endometrial cancer. It's the most common gynecologic cancer, and it's recently overtaken ovarian cancer as the deadliest gynecologic cancer, and over 20,000 women a year die of endometrial cancer. Our project is an endometrial cancer early detection project where we're working with University of Miami and collecting vaginal swabs from women who are undergoing hysterectomy, both for benign and cancerous indications. So we've been able to expand our staff, which has given us resources, not just to work to complete this project, but also in order to open more of the clinical trials where patients are actually seeing a direct benefit of being on trial. The involvement of the Community Foundation has given us opportunities in that regard that we wouldn't have otherwise been able to do. We would have had to say no to some of these trials that we wouldn't have been able to staff.
So what we'll do is we'll ask a question from the two groups, and I think we started already with the most important. We're just chatting about it right before lunch. We all want to know what's happened after 3 years. That's a simple question. So we'll start out with Dr. Fields.
This has really been about creating a solid tumor biospecimen repository, also known as a biobank. And on the first page, the very bottom figure really shows what a biobank is about. So really what you have going on is you have patients who have been treated for cancer. A tumor has been removed. Part of it is certainly going to go to the pathologist, but the remaining part can then be banked. An important point to all of this is that biobanks are not by themselves unique. The issue has been creating a biobank that represents your community. So often biobanks end up tilted towards one particular group, and that's what we're really trying to avoid in creating this biobank. We want it to look like Broward County looks. So as we're getting these biospecimens, we're storing part of them. The other part is we're creating these three-dimensional organoids to better represent the tumor that was inside the patient's body.
Let me get started by saying that, despite all the advances in cancer prevention and treatments, the sad reality is 1 in 3 cancer patients still die today when standard treatments fail. And so when standard treatments fail, we really need better ways. And by providing personalized treatments for patients, we are not only providing what works for each individual patient, but we're also providing options for diverse populations, different ethnic groups. And what we wanted to do is to implement this approach that we call functional precision medicine. Instead of assuming which drugs might work, let's test and find out what actually works using the patient's own living cancer cells. So we take a biopsy of the patient's tumor, we culture those cells outside the body, and then we test hundreds of FDA-approved drugs directly on the patient's own living cancer cells, and we return results back to the oncologist to provide or to guide treatments for those patients.
I would think that send me the sample, send me a piece of tissue, and I'll process it, and I'll give you the drug sensitivity. As easy as that. But it's how the sample goes from the patient to the sterile field to the sample tube to her lab, making sure that the time frame doesn't go beyond a certain amount of minutes, that the sample doesn't come from an area that has bacteria, because if it does, it will contaminate the rest of the lab, and it will compromise the rest of the samples that has already been processed. So it goes a long way, and it involves a lot of infrastructure, for which we're grateful to have received the grant to be able to do this feasibility study.
In this world of AI and everything that we're talking about is AI, and when my wife says something to me, I said, talk to AI, and she'll respond better. Dr. Fields, we'll start with you. What role is AI playing in some of the research that you're doing and the current project that you actually have on?
I think really one of the key parts of it is going to just being able to take all that data in and give an output that says, this is the way we're going to branch all this. This is the path we'll follow if we see these things. This is a path we'll follow if we see others. One of the areas where it gets very complicated is that, I sort of mentioned that you can have a mutation and someone says, okay, you treat that mutation using this drug. But then if you have 2 mutations, even though you have the one, that drug may not work anymore, and there's something else that's better. And then forget it when you start to get 3 and 4 and so on. So I think as we start to gather that information, that is where it's going to be extraordinarily helpful.
That's great. Thank you.
I mean, that's exactly right. So imagine if we have data on the DNA, the RNA, drug response of hundreds of patients and hundreds of tumors all together, and then an AI engine comes in and starts looking at trends. First, we're going to answer the question, all right, maybe these targeted drugs are going to work not because of this mutation, but there's another mutation that is matched to this drug. The second thing is, as we generate more data, we're going to soon be able to predict what works for each individual patient without even needing a biopsy. That's how AI is going to help.
What happened today was fabulous. I mean, I really have a lot of hope because I think that everyone thinks you have to go out of South Florida for care, for research, for everything, especially when you first hear the diagnosis that you might have cancer, you're looking for the best of the best. And I will tell you that I think it's because of programs like this and allowing researchers and physicians to work together and help us get answers, I'm confident staying here. And I've told a lot of people that I know go, oh my gosh, I have cancer. And I'm like, where are you going? Because we can do this here.
When do you anticipate, if you had a magic wand, that these sorts of advances that you're talking about, these protocol changes that you're instituting with your research, if I'm the patient, when do you think I can benefit from that?
As we get more data, we keep going along, but we keep impacting patient treatment as this information comes in. So this is something I just see as ongoing, and people can benefit from this now.
We have a wonderfully rich and diverse citizenry in our county, and so we need to make sure our care is up to the level and the standards and the diversity of our community, and a lot of that can be done through philanthropy. As you're thinking about where you're making gifts and investments, to make sure you're making an investment in cancer research and treatment here in your hometown of Broward County. That's really important because we want our folks to be able to get access to care as soon as possible.
To learn how you can boldly support Broward-based cancer research efforts, visit www.cfbroward.org. Now that's just a taste of what actually came out of that research. So I encourage you to reach out to those researchers to learn more. Now next week, I have a compelling story, and it's personal to me. My mom fell and was not found for several days. And the response of what that does to your body and how she was found, the importance of having a tribe and having people check on you is profound. And so there are so many lessons to be learned from my mom's testimony. And we're going to begin sharing that next week, right here on Newsworthy Stories with Jacqueline Jimenez. I hope you'll join me because this is something you should watch with your parents, but it's also something to consider for yourself if you're somebody who lives alone and is a busy person who might just get turned around and fall. What are you going to do if you can't reach your phone, even though it's right there on the counter above you? You'll hear her story next week, and I hope you'll join me and bring someone else to watch it with you. Thank you so much for joining Newsworthy Stories with Jacqueline Jimenez.